coming to the little seaside towns, the coastal towns, right after the massive earthquake and tsunamis that occurred in 2010, seeing boats up on the shore overturned, even a town away from where they were before, maybe in a cow pasture. What was lost was all the livelihood, the activity down at the wharfs, the fishing boats coming in, the life of these towns, which depended so much on the sea. The sea had become a monster. The tsunami's a monster. And all the tranquility and all the beauty of a seaside town was gone. And I think that for me, having the really deep opportunity to be in these towns about 6 weeks after the event and to see the upturning of people's lives was just, I'm a visitor, but what it must have been for the people to be sitting next to a little chimney fire that somebody had given, not having heat, not having their homes, not having their schools. And so what was lost, the preciousness, was the life, the things that people did for their work, the things that they did day in and day out that we all take for granted. So disaster recovery is about figuring out how to put that back together again. But it's also, in an odd way, about putting things together a little better and saying, you know, if we're going to start again, what are the things we're going to really underscore in terms of the strengths of a place that we care about. As you know, Chile is a long, 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 skinny country, and much of it is on the Pacific Ocean. And you can imagine, it's gorgeous, it's absolutely beautiful. And the places that were most affected by the tsunami are surfer heavens, because these are places where the waves are big, and surfing competitions are held and so forth. The other thing about the towns that were most severely affected is that if you are going to have fishing boats and so forth, you're going to want to have them in a little harbor, right? You're going to want to have them in a very protected place. So that each of the little towns that was hit badly is in a gorgeous little harbor, but the orientation of the harbor is from north to south. And when the earthquake came and the tsunami waves came, they came north to south, just directly at these towns. So they were a major, major target for the kind of problems that happen. And obviously, you know, I mean, even to this day when I go, you think, well, that happened once before, you know, could it happen again, et cetera. But just imagine the you know, beautiful sea, the beautiful little towns, in particular Copacabana, these gorgeous waves that are there for the surfers, and Chile is it's a gorgeous country. So that's you know, it's made the work be a wonderful opportunity. Another little town that we work in is called Paralis, and it's really different from many places in the world. It's a farming town right on the ocean, and it again is a town with a lot of very interesting strengths, but a lot of poverty, and it was hit so badly by the tsunami for an interesting reason, which is suppose you were farming strawberries, and they depend on a particular pH. And all of a sudden, the sea came and seeped into your fields and changed the pH, which is exactly what it did. The strawberries won't grow anymore. And so you've been used for years and years and years to a particular crop, and that's wiped out. So, you know, to be very honest, I've learned all kinds of things by being in this work that are very basic. You know, the tsunami took away a bunch of cows. And one of the things that we've done in the disaster recovery is to say to folks, what do you want? We'd like some cows, please. So that's actually been something we've done, is to buy cows, go out and visit the cows. So personally, this has been and I think for our whole team, a way to reconnect in very basic ways with the physical properties of our world. And as a result, one of the things that I know personally, and I think our team, is beginning to ask questions about the whole locavore movement. We're seeing it around the world. We're seeing local production of foods, local production of crafts, etc., as something that's been dying, that's been kind of moving out of places, people moving to the city, forgetting their roots, forgetting the basics of the natural world. And so a major part of what we're doing in Recompare Chile is exactly tied into, where are these places? These places are important, and place-based work has now become a major area of interest among academics. And we're just sitting on this wonderful, if you will, gold mine of places where we can think about the physical structure, we can think about the human needs, we can think about the productivity, we can work with some future kind of questions about our world. And that's what makes this work so interesting and creative and hopefully meaningful. The tsunami really did affect, or the earthquake and the tsunami really did affect the healthcare system. And one of the things that we've encountered in the work that we're doing is that many of the subspecialty programs or little surgical programs or clinics that were set up as not the big hospitals, but the sort of medium-sized centers, and some of the hospitals were destroyed. And they are only coming back now. So that there were some really missing links in terms of the kind of health care that people were getting. And one of the things that we've done actually with the Recompare Chile program is to try to identify the gaps in care that have occurred. And we've actually identified a number of children who should have had surgeries of one sort or another. One very dramatic situation where we had identified some kids that required a particular kind of surgery. We've been trying to get it for them. And it turned out that after the earthquake and tsunami, you know, there was this kind of I hate to say it, but human earthquake, which is there's a lot of looting, and people looted the hospitals and took equipment. So some of the small surgery centers and small hospitals still aren't back up to speed in terms of being able to deliver service because of that. So it's now 4 years we've been working on this, but we've been able to help identify that problem, and we're pretty sure that the little fellows that need the surgery are going to be getting it now. So it's very exciting. Another thing that happened was the Chilean system had wonderful programs of screening for eye problems, and as you may know, with children around the early part of school, like 5, 6, 7, 8, is when people begin to need eyeglasses. So all the screening for that was stopped. It didn't happen. In fact, my next phone call is about to. And so one of the things we've done in our health program is to rescreen all the kids and get eyeglasses for them and whatnot. So there are things that happen when there's a disaster that you don't kind of think about. But all of that infrastructure that was there was disrupted. So, as is probably obvious from some things I've said, I really think about health, and many people do, as everything from one's physical health to one's mental health to one's really social interactions and ability to function in society, and even to some extent one's spiritual health. Obviously those things are affected by the environment around us, the social determinants. And in Chile, you know, one of the things you do when you're from outside, you go to a clinic and you say, please tell me what are the 3 top problems that you're facing in your clinic, right? It's an obvious question. And the answer in Chile is teen pregnancy, number 1, teen pregnancy, number 2, and domestic violence, number 3. Now, those are pretty horrible things. And when you hear that, you go, whoops, what's going on here? What are the problems? That might not have been what you expected to hear in terms of the health problems. And so when we then step back, we say, okay, what is a healthy child? What is a healthy teenager? How do you kind of think about that? And you have to have that bigger view, which is someone who gets up in the morning and has hope, someone who has a sense of future, someone whose worldview is bigger than, oh, you know, I'm just going to get pregnant, or I'm just going to beat up my girlfriend. I mean, these are things that are illness in a society. So a lot of what we're doing in Recupera Chile is trying to think about how do you create hope in a town that's been destroyed. If we can bring that back as opposed to just the physical structures, that's something that we're working on. This is the reason that we've gotten so involved with economic development, with a sense of pride, a sense of place. I mentioned to you the whole issue about surfing. So one of the young people we're working with right now or 2 people that we're working with in these towns are young, sort of 35-year-old men who have decided to create surf schools and surf shops, and to have a place where young boys can come in the afternoon instead of hanging on street corners and build surfboards and get out into the sea and enjoy the world that's right in front of them. Maybe that will help them not get involved with drugs and alcohol and promiscuous sex. That's a funny way of thinking about it, but that's absolutely what we're doing. The issue of the love of the sea is absolute. From here in Massachusetts, one of my favorite things to do is to go clamming. And actually I grew up going every summer to the New Jersey coast, and I think E.B. White says there are 2 kinds of people, those that like fresh water and those that like salt water, and I'm definitely a saltwater person. And so, in fact, the first reason I ever went to Chile was to see the seashore and go to Chiloe and see some clams. So I think we're all drawn in our work, in our passions and so forth, to things that have some personal meaning. So for me, the opportunity to be working on something that I think is very, very important, but also to use some of the areas of avocation has been wonderful. And so we're working actually in terms of economic development. We're working with a wonderful group of fisher women, it's mostly fisher women, who are working on aquaculture for mussels and oysters. And this is just fantastic. I was talking to you about how do you build community just a minute ago. This is a fantastic group of women and men who see a huge opportunity to build back their community through the sea and through the work with aquaculture, with algae production and so forth. And all the raw materials are just sitting there for them. The situation is just sitting there for them. But these are people who are quite poor, and a lot of their savings and everything have been wiped out. So if in some way Recupera Chile can give them a little dance floor for them to dance on, we'll have that rebuilding of community. And if it has to do with shellfish, I'll be very, very happy. We've been working with a number of groups. One of them is the Chilean Navy. We've been working with a foundation called the Mar de Chile, or the Seas of Chile Foundation. And we've been working with the principal in the school on having one of the topics for the summer school be love of the sea. Because if you can again imagine that this is it's kind of a complicated situation. This is where you live, this is where your home is, this is where your grandparents were, your great-grandparents, even, we've got one family that can trace everything back to the, 1600s and whatnot. But the sea came and was very, very frightening and did awful things. So what's that balance? How do we learn? Well, one thing is got to learn to swim, got to learn tsunami protection and where to go up the hill and how to handle those situations. But at the same time, to value and love the sea. Because I have done a lot of policy work, have had the opportunity as president of the American Academy of Pediatrics to work on the Affordable Care Act and things of that sort. Students are forever coming to see me and they say, I want to do policy. And I always say the same thing to them. I say, I don't know what policy is. Policymakers discover that they need really good people at the local level to carry out the implementation of programs. And you need one policymaker to figure that out, and thousands of people at the local level to do whatever the implementation is. And where we fail over and over and over again is at the local level in the implementation and understanding how to do that. So I'm also a clinician. I'm a doctor. I see patients, and I like to see something happen, tomorrow. And so from the point of view of why is Harvard here, why are we, what's the academic exercise, et cetera, it really is to learn from the local experience and to scrap it up with all of the problems that happen. I mean, with this issue that we're doing with the economic development. The problem is the policies, right? The policies are that you have to wait 10 years to get your acreage in the sea to set up your mussel farm. Well, excuse me, I want to put some food on the table for my family today, not 10 years from now, not all these loops and so forth. And if you don't get yourself into the day-to-day scrapping, you won't understand what it means that policies that are centrally driven don't work locally, that 1 year around for funding decisions. This has been one of the big problems in Chile, is that the monies have come centrally, and the funding from the central government comes once a year. That doesn't help me if I'm trying to set up something for 3 months from now when the tourists are coming to my town. So the answer to your question is I really think that people doing the kind of work that we're doing in the community level need to have that grassroots, on the ground experience in order to then be able to go back to the policymakers and say, this daggone thing doesn't work, this is where we go. So yes, we're talking with ministries of health, ministries of education, et cetera, but hopefully now informed with the real information and the real data about implementation.